Today, I attended the Lincolnshire Health Scrutiny Committee in Lincoln, and I asked a number of questions regarding GP services within the county. First of all, I asked about the recent statistics relating to the take-up of GP appointments and whether these were actually appointments with a GP or with other professional staff in GP practices. I also asked about enhanced access, whereby from the 1st of October, all GPs in England are required to offer appointments up till 8 o'clock at night, Monday to Friday, and 9 till 5:30 on Saturdays. I also asked about whether the GP service would be impacted by any industrial action that is taken by nurses from the Royal College of Nursing in the future weeks. And I've put together a recording of those questions, and you can see the answers that I was given.
I have 3 points, if I may. First of all, the data set that NHS Digital has published on appointments, I've looked at the September ones, very comprehensive, and the thing that jumps out of the page at you is that in Lincolnshire, of all the appointments with GP practices, only 35% of GP appointments are actually with a GP, whereas 60% of appointments are actually with additional roles staff, and 5% are unknown. That actually is that 35% of GPs appointments actually being with a GP is the lowest in England. Now, compared, for example, to a 59% in most of London. And I think I'm concerned, two things. Interestingly, that yet, so we've got the lowest proportion of GP appointments with actually a GP, the highest, therefore, by inference, with additional role staff, and yet the additional roles budget is underspent and we haven't recruited all the staff, which is interesting. I'd appreciate your comments on that. And more importantly, because we are at one extreme of the spectrum here in Lincolnshire, do you think that the LMC and the ICB have done enough to reassure the public that being at one end of the spectrum isn't compromising patient care? Second question, on enhanced hours, are all PCNs in Lincolnshire actually operating the enhanced hour requirement of the NHS now in full? I believe it was supposed to have been brought in on the 1st of October. Are they all operating it in full? And if not, what measures the ICB taken where this is not the case? And finally, and I appreciate that this isn't related to the report, but it is an issue of public concern. Can you just let the committee know if there is any expected effect of industrial action by nurses on the GP service in Lincolnshire? Thank you.
Reid, I don't know if you want to come back on the GP coverage and then I can cover the enhanced hours.
Thanks, Sarah Jane. Yeah, thanks for your queries. We'll cover them between us, hopefully. So in terms of the data set, I think, again, Sarah Jane might be better at explaining some elements of the data, as I've already mentioned for why. But I think what we might find is it's a twofold thing here. One might be going back to Sarah Jane's point about how the data is actually captured. So are we appropriately capturing the data of who is seen by whom? And that's what some of the work we're doing with the ICB is about, making sure that actually if a patient has seen me as a GP, has it been captured as me as a GP? Are we confident that that is the case? And I'm not sure we are at this stage. So I think there might be a data discrepancy there. I think the other element that is likely to affect it is actually the number of GPs in Lincolnshire compared to somewhere like a large population centre like London, as per your example, because we know obviously recruitment and retention is generally more difficult in more rural areas and coastal areas. So you tend to have a higher population density of GPs in those large conurbations of population. So I think it might be a twofold effect there. And I think the overall picture is we've, as we know, as a national picture, we've moved to more of an MDT approach because of GP, particularly workforce shortages. So what we've maybe seen in Lincolnshire is more adoption of those ARS roles, even though, as you rightly say, we've not fully utilised that budget, which is a frustration for general practice as well, because we'd love to have all those extra colleagues in supporting us. So I think you might see that we've accelerated the use of the ARS staff, which may again just skew the data a little bit. In terms of we as an LMC and the ICB done enough, I think you said, to highlight and protect patients. I think what I can say is we're working extremely hard, both in general practice and from the ICB perspective, to optimise services and support our colleagues, to support our patients. I think, bearing in mind what I just said about the data set, I'm not convinced that data set is as accurate as we'd like it to be. And I don't think there's a risk in Lincolnshire above and beyond any other area of the country currently in terms of risk to patients. I think everywhere is working extremely hard with a lot of demand, and we're trying to be as safe and high quality for patients as we possibly can within those confines. And we want more colleagues on board, including those our staff, to support patients. Forgive me, I've forgotten what your other points were. Enhanced access, I think Sarah Jane will be able to give you the details better about that. From my perspective, I think everywhere in Lincolnshire is providing that service. I think what I would say, and Sarah Jane may correct me, is they aren't necessarily fully utilised, they're all offered, but what we tend to see is patients, although they want access that's timely for them and convenient for them, it doesn't necessarily mean that all those appointments will be taken by patients, because sometimes at the weekend they want to go and do something else because they've been working hard all week. And to be fair, to a degree, because of things like online consultation, working age patients who wouldn't necessarily have been able to contact their GP practice at 8 AM on the phone have got access now. So I think we're just anecdotally, I'm seeing less patients who are finding that challenging. But Sarah Jane will have better information on the data.
Yeah, no, thank you, Reid. And just to build on what Reid was saying, in terms of the clinical service, as you will see in my report, we rely on the independent assessment by the CQC, and I know you've got a report later in terms of one of the practices, but 74 practices out of 82 are identified as being either good or outstanding, and that gives us a high degree of confidence that they have the appropriate arrangements in place to make sure that the treatment being provided is being provided by the right person. And I think increasingly, as Dr. Baker has explained, we are seeing colleagues working as part of a multidisciplinary team. And what that means is that whoever has the contact with the patient does have access to that range of clinicians, including the GP, that can provide that intervention if somebody else assessing the patient feels that the GP is needed. And there's some great examples across the county of where that multidisciplinary team working is improving the support to patients. So particularly for patients with complicated needs, the frail, elderly, where a lot of the time the support they require isn't just the medical, which would be the expertise of the GP, but maybe more around the therapeutic or the medicines review, which are actually the expertise of other members of the team. And what we're seeing is that holistic care being coordinated by a clinical nurse specialist or a clinical therapy specialist is really enhancing that holistic support. And that means that the GP isn't trying to coordinate all of that intervention. Those individuals are getting quite bespoke services, but the GP, if required, will then be contacted. Normally, will be able to respond on the day, do the medical intervention, review the medication, or even go and do a home visit for those individuals. But that is the development, I think, that we will see increasingly as the multidisciplinary team develops. We are aware, though, that Lincolnshire, in terms of GPs, is lower than the national average, and that if you look at our percentage, we do have a higher percentage than elsewhere in the country of other healthcare professionals. And we are working very, very closely with the training hub, Health Education England, the university particularly, to make sure that we develop a range of career opportunities so that younger people that come and train with us actually want to stay with us, which is really, really important. And we can see where we've got strong training practices the positive impact that has on recruitment. We're also working with colleagues at the other end of their career and encouraging them perhaps to stay in practice by being more flexible in terms of the type of roles that they can take on. So for some colleagues, they do want to move away from the partnerships as they're moving into retirement age, but they actually quite like clinical work. So we're looking at how we can develop that. But in terms of clinical care and clinical safety, I can absolutely be confident, both from my own contacts with practices, but also from the independent review, that the clinical care is good and strong. And where there are practices that need that additional support, again, my team and colleagues who will talk to you later provide very bespoke support, and the LMC also have a team that provide bespoke support to those practices. So there will always be practices that for whatever reason will be struggling at any point in time, but we've got a very well tested formula of the support that we provide to them. In terms of the enhanced hours that you asked, I can confirm that we have complete coverage across Lincolnshire. But again, I would highlight what Dr. Baker has said, that those appointments don't get fully utilised. So we need to keep a close monitoring of that, because this is the same workforce. And what we're doing is providing overextended hours, and we've heard about the pressure and some of the difficulties people have accessing appointments. If we've then got periods of time that we've commissioned that aren't being fully utilised, then we need to be open to perhaps reconfiguring that so that we get that capacity in the right place. And then your final question, which was with regards to the industrial action, I'm afraid I can't answer that at this point in time in terms of what the impact will be. Inevitably, there will be nurses working within general practice who may decide that they want to partake in the industrial action. And as with other colleagues, we will monitor that. My colleague Terry Vine, I can see, has just put his hand up. He might be a little closer to this with his nursing hat. So Terry, can I invite you in? You're on mute, Terry.
Not a great start. So thank you, Sarah Jane. So I'm Terry Vine, Deputy Director of Nursing and Quality at Lincolnshire Integrated Care Board. So the Royal College of Nursing are only balloting nurses that are directly employed by the NHS through Agenda for Change contracts. So it won't affect general practice unless we have general practices that are run by an NHS organisation. I think there is only one that is run by LCHS in Lincolnshire. So it is not expected to have any impact at all on general practice. And also not all nurses will be members of the Royal College of Nursing. It is only the Royal College of Nursing, and there will be other union and professional organisation that nurses will be members of that won't be part of this proposed industrial action. I know that we're expecting an announcement today of what the decision, the outcome of the ballot will be, but I'm not expecting it to have any impact on general practice.
Thank you, Terry. That's really helpful.
Thank you for all your answers. Just to underline what my question was regarding public confidence in the GP appointments, my concern, and you really haven't quite directly answered the question, do you think you're doing enough to make sure that there is good public understanding and public confidence in the fact that the lower proportion of people being able to actually see and have an appointment with their GP isn't undermining public confidence? People understand that and understand exactly what's going on, why they can't always get an appointment with their GP, because that's not what's coming through to me. So again, it's not a question of the fact that we're questioning the integrity of the system. We're questioning whether there is a proper public understanding and whether you're doing enough to make sure that public understanding is there. Secondly, in terms of enhanced hours, I have anecdotal evidence that, and it is only anecdotal, that that's not being operated in full across all PCNs. I'll deal with. I'll mention that to you outside the meeting. just a thought. I mean, would the ICB consider asking and requesting that all GP practices do publish how they are conforming to the enhanced hours on their website? Because it's certainly the case that my GP practice has got nothing about enhanced hours on its website. So I think, again, there's a question of public not being properly informed on it, potentially. Thank you.
Thank you. And yes, I will pick up with you if you think there's an area that isn't fully providing that. I think that we have got a lot of work to do in terms of the communication with the general public to help them understand that the primary care service offer is very, very different to the one that perhaps many of us grew up with. I don't think we can ever stop doing that. But when you say, do I think we are we working on that? Yes, we are absolutely working on it. And my colleague Kev Gibson is actually connected with this event so that we can hear the feedback and make sure that we absorb and take that learning. I think we have got a lot of work to do about helping people understand the full extent of the range of services that are now available to support people right through being able to get symptom check in terms of on your NHS app. Which again, going back to the previous comment about health inequalities, we know that isn't for everybody, but for a lot of people, using the NHS app is a really, really useful tool for symptom checking or ordering repeat prescriptions, and that reduces some of the footfall through to practices, right through to this, as I've described, a very, very different way of working for some of our more complex patients with more complex needs who need the multidisciplinary team. I think we've got a long way to do to help people to understand that. And it's something that we continue to do, and will, I think as well, we want to open up the discussion with the general public to understand what information is available and how we might adapt that to make it more meaningful for people. But I think at different points in your life, you need different things, and that's something we've got to understand. If you're a mum with a baby, that's very different to I'm in my 85th year and I need some particular support with my complex needs. So I think we've got a lot of work to do on that. Reid.
Thanks, Sarah Jane. Yeah, I just wanted to build on what Sarah Jane was saying. I think exactly right. I agree. There is a lot of work to be done. I think I'm just going to reflect back on what I was saying earlier about meetings for myself and other clinical colleagues, making them count. And I think we get a lot of information as clinicians, emails coming through, and I'm sure everybody in the meeting today does. But it's about getting that message to the patients, the important messages between all the other messages they get in every media format that it comes at them. So I think that's really one of the key things, as well as getting the information right, getting the information that's most important front and centre for patients. So that is something that is extensively being worked on currently. What I'd also say is I think more than ever now, we've got more of a two-way flow of communication with general practice in our patients. And that's going back to one of the positives I said about technological advances. So a lot of practices now have Facebook sites, other social media sites, and they can put information real time on there for patients. And that helps, because I think having some transparency and patients understanding what's going on in a practice really helps to sort of have that two-way understanding and support. So while there's still work to do on that as well, I think it's a positive step forward that we've got that for patients.
And just to come back to your question about enhanced access, my colleague Sarah Starbuck is also on the call and has been leading on the enhanced access. Sarah, I don't know if you just want to come in and say some of the work that you will be doing around the social media and the information on websites.
Yeah, of course. I'm Sarah Starbuck, Head of Transformation and Delivery for the ICB. So I've been leading on this, supported by colleagues, but also LMC colleagues, in terms of reviewing the enhanced access arrangements. We will be making sure this is well publicised. It's part of our winter plans. So we are promoting the access. We will make sure it's on all of the practice websites, it's on all the social media channels, and we publicise through other routes as we've done for other services. So it is a priority for us. We have given PCNs a couple of weeks just to get the service embedded. It did only begin in its new format on the 1st of October, and we are now working to review it and get it promoted. As Sarah Jane said, utilisation is still far from 100%. We want to promote this and encourage use for patients because it is evening and weekend offer, which we do see good take up, but we don't see full take up for. So we want to promote that over the coming weeks.
Just to follow up really on the better public understanding issue, I noticed, for example, that the ICB has an excellent YouTube channel. It's got excellent content. It's got some superb videos. It only has 9 subscribers, and there's an excellent video on there about getting an appointment with a GP practice, about all the different roles, additional roles of who you might be signposted to see that. That excellent video has only had 85 views. So, I mean, just to reinforce the fact that I do think you have a lot of work to do in terms of better public understanding, not just of the technology, but of course, very importantly, what people who don't have access to technology need to do. I've come across issues, I just really want to highlight these. My GP practice sends web links to phones that aren't smartphones, which is incredibly frustrating to people who have a phone that isn't a smartphone and can't use the link. I really think that something needs to be done about that. Also, NHS app is brilliant, very, very good. Anyone I know that's used it loves using it. However, not all GPs actually allow the messaging service on it to be switched on. Very frustrating. You go to the GP app, I can reorder my meds, I can't message my GP. I have to go to the online portal, doctoring portal, and answer a whole load of questions that I've answered lots of times before just to put a message in. And finally, again, just to reiterate, enhanced hours. Please could you ask every GP in Lincolnshire to put on their website exactly what they're doing with enhanced hours so people know, because again, it contradicts the comms, or it appears to contradict the comms that the ICB puts out directly on Facebook and Twitter, for example. So those really were just some points I wanted to add, because obviously it's pertinent to your report and not specifically to the LCM one. Thank you.
Thank you, and I won't repeat the discussion we had previously, but really value that feedback and would absolutely concur. There's much more we need to do in terms of communication with the public to help them understand the services, and we will be making sure that the information around extended access is on all of the GP practice websites.
If I could just add to that, Sarah Jane, if I may, there is going to be some national and regional resources for the public around how to access primary care services and what all the different roles within the GP practice do. So I think that gives us an opportunity to really reinforce some local messages, but really helpful to get that feedback. Thank you.